patients feel like they're not receiving good care or they feel like they're being treated unfairly, what steps should they take to access better overall care?
Yeah, it's a tough one. I mean, it makes me sad that that even happens, but it does.
Yeah.
Um, I would say, just never be afraid to be an advocate for yourself. Ultimately, it's your life, and the consequence of bad healthcare, unfortunately, is not going to be on those providers. It's going to be on you. So I think, fortunately, I do hear from a lot of people. They worry about burning bridges or annoying someone or angering the doctors that they're working with, and I would tell them, don't worry about that. I think I don't think people need to care about my feelings or the doctor's feelings about the situation. You need to make sure you're getting the best healthcare possible. So always feel comfortable getting a second opinion. Going to a bigger center, and I would say I always recommend go to the main hospitals in your area. I think in the U.S. especially, I think we're too focused on convenient healthcare and not the quality of the healthcare, and
Mhm.
so I definitely would advocate, even if it takes you an hour to drive downtown to, if it's the Duke or Johns Hopkins in your area or the Cleveland Clinic or the Mayo Clinic or whatever, it's worth that time compared to the person who just might be 5, 10 minutes from you.
Right. Are there resources available now that might be useful for people who want more information?
Yes, that are you talking about things that they could find like online to read about, or and it's in terms of like sort of accessing care or just generally about.
Yeah, accessing care.
Yeah, I think there, yeah, again, I would go back to, I think the American Cancer Society, and then the other ones that are really great too are for colorectal cancer especially. There are a number of really great patient advocacy organizations. The two that are coming to mind are Colorectal Cancer Alliance and then Fight CRC. And both of them have phenomenal resources as far as patients who have gone through the whole journey and in various phases of the journey. And what I love for them too is that there's somebody that can represent your area, in those settings, in those support groups and whatnot. And so I definitely think, they're a great resource for helping people to, find out who are the best doctors in your area. How did you get connected with them? And because unfortunately, we all have phone numbers online and whatnot to find us, but we all know when you call them, you end up in this kind of interminable loop, it seems like sometimes to get an appointment. It's hard to navigate it all. And so I think a lot of times these patient advocacy organizations can be great bridges to both finding who the right people are and then how do you best get in with them.